Review patient visit and report. There will be instances when you may not be able to finish the review of patient recordings and report at the time of electrodiagnostic study. You will need to do this in an offline manner, perhaps from an acquisition station or from a reader station. Here is the procedure. If necessary, click on the patient list button. The patient list will be displayed as seen currently. We can organize this using different fields. So if I click on patient ID, the list will be sorted using patient ID. Or I can click on last name. Now the patient names are shown in alphabetical order. Another method is to click on last visit date. The patients are organized based upon their exam date. So in this case, the oldest patient is at the top, the most recent patient is at the bottom. Click on the desired patient name. In this case, I'm going to review the records on patient James Martin, who was the most recent patient. So that is at the bottom of the list. When I click on the patient name, we will have information about all the visits in the bottom window. It indicates the date and time when the study was performed. To review this visit, double-click on this line. The first test performed on this patient is loaded in the system for review. To review the next examination, click on the Review Next icon and continue the process as necessary. We can also use the Review Previous icon to go back to an earlier study. During this process, we can change the display of traces, we can change the marker positions, change the measurements, and so on. Upon completing the review, click on the Exit Test button. Let's look at the report. Click on the Report icon. The report is shown in Microsoft Word. Review the contents of report if necessary. And add any narrative if necessary. You can print this report. You can save this report in a PDF format as a backup or send it to an electronic medical record system. Having completed the report, let's close this document. Click on the X symbol in the top right corner. And then click on the patient list icon to close this study. You will be given a warning if you had made changes. Click on Yes or No as appropriate.